After 17 years as a physical therapist, I've learned 17 tricks that can help to relieve pain fast, especially in people over 50. In this video, you'll learn quick tips to relieve pain in your back, hips, knees, feet, neck, and shoulders. These are the same kind of tips that I would give to a family member if they asked for help at a holiday gathering. They work fast, they work for most people, and even if they don't work, they're safe and unlikely to make the problem worse. Now, not every tip works for every person, but it's likely that you'll find at least one or two that can help you to feel better. So let's get started. We'll start out with tips for lower back pain because that's one of the most common problems, especially in people over 50. And most back pain over 50 is related to loss of disc height, which causes the joints in between the spine to jam into one another, or for you to pinch these little nerve roots right here in your lower back. Now, when you bend backwards and arch your back too much, that jams the joints together and pinches the nerves more. When you flatten the back or flatten the curve in your back, that opens up the spaces between the joints, takes pressure off the nerves, and can help you to feel better. So that's what we're going to do for the first couple exercises. One of the quickest and easiest ways to relieve back pain, particularly if you get it when you're standing or walking for long periods of time, is to sit down in a chair and just bend forwards like this. This forward bending motion opens up the spaces between your joints, takes pressure off the nerves, and can help relieve pain quickly. Do this for 30 seconds to a minute or until you feel like the back pain is going away. The next exercise will be primarily for one-sided back pain or pain that's worse on one side than the other. If this is the sore side, you'll take your arm and reach up in the air and then lean towards the opposite side. This opens up the joint spaces and nerve spaces on this side of the back. It also stretches out a muscle called the quadratus lumborum. Once you're in this position, reach up towards the ceiling with this hand while taking a deep breath into the rib cage on this side. Hold that for a couple seconds, then breathe out. Then reach up again. Take a deep breath in, hold a few seconds, and then breathe out. And repeat that 5 to 10 times, reaching up a little bit higher each time you breathe in. That's the second exercise. Now, the third tip for back pain is going to be when you're standing. And again, if you stand with a lot of arch in your lower back like that, that jams the joints in your spine together. So you're just going to roll your pelvis underneath of you, trying to flatten the curve out in your lower back. This opens up the spaces between the joints, relaxes your back muscles, and also takes pressure off the nerves. So those were the 3 tips for back pain. The next 3 tips will be for hip pain, but they also work pretty well for lower back problems, particularly if you have some sciatica as well. This first one, you're going to cross one leg over the other and then just push down like that. You should feel a stretch in the back of the hip. That stretches out a muscle known as the piriformis. The piriformis can cause problems with your SI joint or sacroiliac joint, where your lower back joins with your pelvis. It also runs over top of the sciatic nerve and can occasionally cause sciatic nerve problems. Hold this position for a minute for a comfortable stretch. If you need to intensify the stretch, you can also lean forwards like that. A different way to do this stretch is pulling your knee up towards your shoulder. I would try one way, try the other way, and then see which way feels better for you. So again, the options are pushing down that way to stretch your piriformis, or pulling up towards the opposite shoulder. The next stretch is going to be a hip flexor stretch. This is particularly good for people who have pain in the front of their hips, but your hip flexors can also cause lower back pain, and when they're stiff, they pull you into a forward tilt like this, which again can jam the joints in your lower back together. To do a hip flexor stretch, you'll stagger one leg in back, one leg in front, roll your pelvis under, doing a pelvic tilt, and then just squeeze your glute and push your hips forward like that. That stretches out the hip flexor on that side. Now note, you don't want to allow your lower back to arch, so make sure you keep that pelvic tilt, push the hips forward, squeeze the glute on that side, And then you'd obviously repeat that on the other side, rolling the pelvis underneath, squeezing the glute, pushing the pelvis forward, and holding the stretch for about a minute. Now, another thing that's really important for people with hip pain is avoiding too much tipping side to side when you're walking. That can overstretch the tendons of the muscles on the outside of the hip, which can lead to tendonitis, tendinopathy, or bursitis type problems. In order to stop that, you want to be able to balance on one leg. So squeeze your glutes on this side, try to keep your belt line level, and then hold that position. Now, this is an exercise will not relieve pain right away, but one thing that is helpful to relieve pain quickly when you're walking, if you have pain every time you step down on the sore hip, is to think about squeezing your glute every time you take a step. So squeeze the glute, squeeze the glute, squeeze the glute, squeeze the glute. So those are the tips for hip pain. Now, the tips we'll go over for knee pain mostly have to do with knee joint alignment. The reason that we're doing that is that a lot of the tips that we covered for hip pain and also some of the ones that we'll cover for foot pain will also affect your knee. One of my favorite ones for knee pain is crossing your leg over like you're doing the piriformis stretch that we discussed before. But now we're going to add just a little bit to it. You're going to push with this hand just above your knee on the inside of the knee and pull with this hand. So you're creating a translation and also a little bit of rotation at the knee joint. This one is particularly good for people who overpronate or who flatten their foot out too much when they're walking. That causes the thigh to rotate in that way and the lower leg to rotate out that way. So with this stretch, we're doing basically just the opposite. You're crossing the leg over, you're twisting the lower leg inwards while pushing the upper leg outwards. Then just do little tiny oscillations for about a minute. Now the next one is basically just the opposite of that. So if you try that one and that doesn't work, you may try just the opposite motion. For this one, we're going to be pushing the shin outwards and pushing the thigh inwards. So you'll take your hand, put it on the outside of the thigh, inside of the shin, and then you'll use your knee over here to help translate and push the lower leg outwards while pushing the upper leg inwards. So that's the second knee exercise. For the third knee exercise, you'll need a rolled up towel like this one. You'll put it behind your knee like this and then bend the knee. This creates a little space behind the knee joint and kind of gaps the knee joint capsule. So you're going to pull into the towel like that, pulling back as far as you feel comfortable going. That helps open up the space between your thigh and your lower leg. If you have some outer knee pain, that can also help mobilize a little joint right here on the outside of your knee. So again, tuck the towel up in there and pull your knee towards you as far as you can comfortably. You may have to play with how thick or thin the towel is based on how far you can bend. The next three tips will be for foot problems and particularly for plantar fasciitis. You've got an arch in your foot, but if you flatten or pronate your foot too much when you're walking, it can cause one of those little bones to fall down. So if you run your fingers along the inside of your arch here, if you feel something that sticks out that's also a little bit sore or tender, take your thumb and put it right over top of that bone. Now you'll take your fingers and wrap them around like that. Then you'll push up with your thumb while pulling your fingers down like this. That helps to shove that bone back up in the arch where it belongs and often helps relieve foot pain quickly. Another problem that can cause foot pain is stiffness in the calves. Not only does this not allow you to take a full step length and cause you to overpronate, but your calves can actually refer pain down into your heel or into your foot. If you squeeze along your calves, kind of pinch particularly along the inner calf here, you'll likely find a knot or a trigger point like this. Once you find one of those sore, tender knots, just squeeze a gentle pressure on it and then hold it. Oftentimes you do have to hold this for 1.5 to 3 minutes, just putting a gentle pressure, and over time you should feel like that knot loosens up or kind of melts away underneath your finger. Then once you're done, move around again and see if you can find another knot in the muscle. You've got your more superficial gastrocnemius muscle, and again, the most common places that you'll find those trigger points in that muscle is on the inner side. Additionally, you've got a deeper muscle called the soleus, and if you push from either side, pushing in like this, you can trap a trigger point in your soleus between your fingers, and then again, just hold for 1.5 to 3 minutes. So that's the second tip for plantar fasciitis. Now, if you have the classic step out of bed and your foot hurts first thing in the morning, this next tip is going to be especially helpful for you. That happens a lot of times because your calves do get stiff and then you overpronate your foot or flatten your foot out too much when you get out of bed. So one thing that's really helpful to do is thinking about doming your arch or kind of gripping the ground with your toes like this and form an arch in your foot before you go to stand up. If you stand up and flatten out first thing, it's probably going to hurt. But if you dome the arch, put the weight just a little more to the outer side of the foot, keeping that arch lifted like that, and then take smaller steps, keeping the arches domed until your calves loosen up through those first couple steps. You'll likely feel a lot more comfortable if you have foot pain when you first wake up in the morning. So we've covered lower body tips. Now we'll move up to the neck. These are some of my favorite tips to relieve neck pain quickly. And the first one is for neck pain that's just at the base of the skull up here. Particularly if you get it on both sides or if it causes some headaches, this one is really great for that. What you do is you take your hand and you kind of pull down like this. You're not pulling your whole neck down. You just want to focus on this top level right here. So you'll push up from the back with one hand, push down from the front with the other, and you're just causing a slight rotation and a little bit of a traction force up that way. So pull down here, push in, pull up here, and then hold that for about 10 seconds, and then relax, and then repeat that, hold for 10 seconds, and relax, and do about a minute of total stretch time. Just pulling and holding for a few seconds, and then relaxing, pulling and holding and relaxing. That stretches out the suboccipital muscles in the back part of your head, which again are often related to pain just below the skull or headaches. The next one is more for one-sided neck pain. If you feel like you have some pain that's just on one side of your neck, the most common thing people will do is try to stretch away like this. But this treats your neck as if it's all one segment. You've got 7 individual vertebrae in your neck, and oftentimes it's just one segment between 2 different vertebrae that's actually causing the problem. To be a little more specific than just going over like that, if you think about starting from an axis of rotation through your nose, and then just moving down a little bit farther, a little bit farther, and you're not pulling with this hand again, you're creating a vertical compression through your skull. So tip over to the side, just a slight compression downwards with this hand. You feel it right about there. Go a little bit farther down, feel it right about there. Go a little farther down, right about there. Pull a little farther down, and you feel it right about there. So that helps to localize the stretch a little bit better than you could just tipping your head over to the side like that. For this next tip, you'll use a towel, and you'll wrap the towel around your neck like this. This one's particularly helpful for people who have limited range of motion in turning, or if it hurts if you turn towards one side. We'll do this to help turning that direction. So you'll grab with the opposite hand and you grab across your body like this. Then take the hand on the side that you're going to turn towards, reach over top, and you'll pull the towel across your cheekbone like this. You're going to pull down with this arm right here while pulling across with this arm. And just go as far as you can comfortably, and then come back to the middle. Go as far as you can comfortably, go back to the middle, go as far as you can comfortably, and back to the middle. And repeat that 10 times. Now, if you have difficulty on both sides, then you could do it on the opposite side as well. So to go this way, we'd grab across with this arm, reach over top with this one, pull down with this hand while pulling across the cheekbone with this hand, and then just repeat the exercise like that. The next tip will be for shoulder pain. And this one's particularly helpful for people who have trouble when reaching above their head, which is probably one of the most common complaints among people with shoulder pain. Now, usually when people reach above their head, they'll reach for something like this, with their palm down and elbow out. What that does is it puts your shoulder in a position of internal rotation, which causes you to pinch your rotator cuff tendons because there are some bumps on the ball of your shoulder joint. However, if you keep your elbow tucked in and reach leading with your fingers and thumb first, like this, as opposed to like that, that often instantly relieves pain either completely or at least helps to decrease it. Now, the last tip that we'll go over is for knots or trigger points in your rotator cuff tendons, and particularly the teres major and teres minor on the side right here. And technically the teres major is not a rotator cuff, but they're right along the side right here. If you pinch on these muscles like this, kind of entrap that knot or trigger point between your fingers, and then again, just hold for 1.5 to 3 minutes. Hold until you feel like that trigger point loosens up or melts away. And then after doing that, try reaching up or reaching backwards or whatever was bothering you and see if your shoulder doesn't feel a little bit better. And then to relieve trigger points in the back of the shoulder, in the infraspinatus, you can use a tennis ball like this. You'll put the tennis ball down underneath your shoulder. It does work best if you use the floor or another firm surface. And then roll around until you find that knot or trigger point. And then just like the other techniques, you're going to lay there for 1.5 to 3 minutes or until you feel like that trigger point loosens up. I guess you could technically consider that last one an 18th tip, but 17 tips in 17 years just sounds better, right? Well, actually, I've learned a lot more than 17 tips, but these are just the ones that help to relieve pain fast in most people. Now, take note that these are more pain relief tips. They don't necessarily fix the underlying root cause. Now, if you do need some more individualized help to figure that out, I'll put a link down in the description for a one-on-one consultation with me. And if you're just looking for some more tips, check out this video over here that YouTube thinks you'll enjoy. Thanks for watching, and I'll see you in the next one.